elbow joint. Now this joint is a hinge joint, a synovial joint, uniaxial joint. It's formed by the humerus and the ulna, the trochlea of the humerus and the trochlear notch on the ulna, and the capitulum of the humerus with the radial head. And also you have the superior radial ulnar joint with the head of radius and the radial notch on the ulna. So that's the articulations of this joint. And I want to make a small point here. I just have to look at these figures, and this is more easily identified. You can see that the angulation of the lower end of the humerus and the upper end of the ulna, the trochlear notch of the ulna, are sort of inclined at an angle of 45 degrees anteriorly. Now, this will help flexion to 180 degrees at the elbow. If it were to be straight, like how it is shown here in F, G, and H, you find that there will not be a full flexion at the elbow accomplished in this way. Since it is arranged like this, here in C, D, and E, you can see that when there's a full flexion at the elbow, you can find